on lockdowns, whether they actually help or not. We looked at triangulation, so we'd compare, how did our outcome compare to Sweden, where they had none of these things. They didn't close any schools. They didn't mandate anybody to do anything, because legally they couldn't, I understood. I've talked to the Chief Medical Officer of Health, who was for Sweden at the time, Anders Tegnell, a great guy. And if you look at it, their outcomes are better than ours. And they have social medicine, so you can compare apples to apples. You know, it's hard to compare Alberta to somewhere in the States sometimes, because the medical system is very different. But you can compare us to a Nordic country, I think, fairly clearly, and showing that they didn't really have much impact. So what came of it is it didn't really seem to matter what people did as far as lockdown and masking. It didn't have much impact. In fact, if you wore a fleece mask, like a turtleneck or a neck warmer like we have in Canada when you're skiing, it actually made it worse, because then it took droplets and broke them smaller, aerosolized them, and they hung in the air longer, making it more dangerous.